Okay, so hello everybody. Hello ERC. Good afternoon. And it's really, really nice to see you here sa ating mga taga-subaybay na nandito sa Zoom. At mayroon po tayong bagong addition sa ating mga ways or platforms that we can watch our ERC Cares from Inside Out every Wednesdays at 4 p.m. Yun po ay YouTube. So if you're on YouTube or you have your access to YouTube, you can also view us there by searching ERC Cares from Inside Out or ERC GADS webinars. Okay, so for this afternoon, we'll switch to care not only from the inside, a care that shows also on the outside. So it's about skincare. So next time I see everybody around in ERC, dapat glowing skin. Kung ano kayong makikita yung mga glass skin. Ayan, ibig sabihin, happy skin kayo. Ibig sabihin, happy inside din kayo. So, I think it's a minute before 4 p.m., but I can already start introducing who our resource person is. Actually, this resource person is very close to the heart of our chair because she is actually the sister of our chair. Okay, so let me introduce you to her. Our speaker is Dr. Mary Jane M.J. Torres. She is the owner and head doctor of the Zen Institute, and she's a graduate of University of Santo Tomas Faculty of Medicine and Surgery. She had her postgraduate internship at St. Luke's Hospital and underwent trainings with renowned pathologists and surgeons uh, in the country, making her now one of the renowned names in that field. She's also part of a teaching group based in Thailand, conducting workshops and trainings on aesthetic medicine for Asian doctors. And as you know, the moment, nanonood siguro kayo ng mga Korean novela, Asian novela, the Asian celebrities are really known for their glowing skin or minsan glass skin. MJ underwent training on Botox in Istanbul, Turkey, and lipotherapy training in Athens, Greece. And she's a member of the International Society of Mesotherapy, the French Society of Mesotherapy, and the Italian Society of Aesthetic Medicine Surgery. We'll know a bit more about mesotherapy in the session, so stay tuned. Dr. J is a hardcore believer of non-invasive surgery and well respected in the medical field for that. But more importantly, Dr. promotes a healthy lifestyle through a lifestyle of wellness, which she even personally coaches for her clients. And the line of clientele of Doc MJ also includes well-known and celebrities here in the Philippines. So, being the woman behind of the Zen Institute, it's a sustainable come from it guiding laws, which is simple. From our inner peace comes true beauty. So, without any further ado, and to begin our Wednesday webinar, I am glad to introduce and bring to you our research speaker for this afternoon, Dr. Mary Jane M.J. Torres.
Good afternoon, everyone. It's really an honor to be here talking to all of you. And of course, is the chairperson present? I'd like to greet her also. Good afternoon. Anyway, I'm sure now that you're at home, you have all the time to really focus on yourself. No? Actually, there are a lot of advantages of being locked down at home. You can start doing all this stuff for yourself. But let me share with you just a few knowledge of why we would always tell everyone to take care of our skin. Can I start uh, the lecture? Oh, I wouldn't call this a lecture, but maybe just a few information, okay, about, of course, about the skin, about aging, and can I say that my endorser here is none other than your chairperson. Okay. Actually, when she was interviewed in the TV, this was this morning by Ted Filon. I didn't even know that she was interviewed, but there were people calling me and texting me. Doc MJ is attorney doing treatments with you. How come she's glowing? Okay, so I just kept my mouth closed. Anyway, so the skin that I'm in, and that's a very good title actually. So I use it still. Okay. So I'm going to be telling you about the basic skincare. I'm sure most of you are already doing it. And the one that's very challenging is the anti-aging process. Okay. I'm sure you see this in a lot of um, uh, videos, textbook. Even if you're not a doctor, this is usually seen. No? And it's always a saying that the skin is the largest organ of our body, and it does compose of 16% of your total body weight. And most of the time, we just neglect it because it's just like a covering. Most of the time, we cover it with clothes. Uh, Today, because of coronavirus, we even cover our face with mask when we go out. No, and when you come to any clinic, or like in our clinic, we even to cover everything from our hair down to our shoe. And the only thing seen are the eyes, which most of the time we even wear goggles, no? But still, it is the largest organ of our body. It has the layers. I'm sure you also know this: epidermis, dermis, and hypodermis. Okay. Now, if you can see that epidermis, though it's very fine, and you won't even, when you do have a cut in your finger, all you see is blood, and you'd say, oh, it's just paper cut. It's nothing. But under the microscope, there are a lot of layers, no? From the top, which is the epidermis, is even more layers. And there is the what we call the basal cells. The melanocyte is the like the one that has the mole, okay, and melanin pigments. Then, it's if you can see in the illustration, we have the basal cells that when it gets old, it becomes the squamous cells, and when it becomes older even, it becomes the keratin on that top layer. This is where you get your calcium, you know. This is where um, the first, sorry, this is where the uh, pag sinasabi niyong nagbabalat yung inyong skin, nasa epidermis pa lang yun. Nasa top, very top layer. Okay. And the second layer is the dermis. No, the dermis, it's where the root hair is implanted, where the blood vessels. So when you do get a paper cut, it's up to the dermis, and even hopefully it's just up to the dermis, because when you press it, you stop the bleeding. Okay. There is also what we call sebaceous gland or oil gland on the face. When you find yourself very oily skin, then it's because your oil glands are very active, and that oil gland is at the dermal layer, or we call it dermis. And again, the hypodermis, it is where the roots, when you do laser hair removal, um, a good laser actually penetrates until the hypodermal layer. Okay, when there is also there you can see the so-called adipose tissue. Okay, adipose tissue means fat. So when we do mesotherapy, we try to sculpt the body or any part of the body or even the face. We have to reach that part of the skin where there is fat because that's the one that we try to remove and dissolve. Okay, so it may really look so, the skin is so huge with so many layers, but when you see it with your naked eye, it's very thin. You can't even decipher which is which. But it's a very good thing that you should know more or less what's in our skin so that you would also know how to approach the care of the skin. Next. Okay. Why did I discuss the skin first? In the aging process, it's always the skin that's always being mentioned, or we're always it comes to our attention that it's the skin first. We get the wrinkle, we get the uh, dark skin when we do age, and this is why we always have to work on the skin. Where is? Hold on. Let me just go back to my slide. Okay. Okay, dito pa I can focus. Okay. So now when we age, actually aging starts early adulthood, and that's around 25 to 35. So when you talk about aging, you just don't talk about your parents. So I'm sure most of you are in the 30, 40s. Okay, and aging begins at 25 when you're really not conscious about your skin. You're not even conscious about your body because that's the time when you start to build your career. If you're still studying, you you don't care about anything at all but just your studying. When you work, you have your deadlines, you have your bosses. Okay, you have your superiors, and that's what's more important to you. But little did you know, aging begins at 25. Okay, and that this is where you should start taking care of your skin. I think I missed some of my slides. I like to apologize. But anyway, going back to the skin, uh, the basic of skincare actually is skin uh, cleanse, tone, moisturize. Okay, and when you do that, no, that's usually in the morning. But don't forget that in the morning you should also wear sunblock. Remember, we are in the Philippines. It's a tropical country, and therefore you always have to protect your skin with sunblock. The sunblock that can also be a moisturizer, a sunblock that can definitely shield the UVA, UVB, and infrared. Okay, what am I talking about? The rays of the sun has all these ultraviolet rays, and you don't know which one is. They're promoting have a sunlight in the morning. It's good not too much because it can hurt skin. The skin can be dehydrated, and then it can. How come your skin is with my other sister? Your skin is a little bit dark now, And it's lockdown. What happened to you? Just to find out every morning, she goes to her veranda, have breakfast, and she said, because the sun is good in the morning. But what she forgot was to wear sunblock. And it's good to have the rays of the sun every morning, have breakfast, but don't forget the sunblock. You can use any kind of sunblock. You can use gel if your skin is oily. You can use sunblock cream if your skin is normal to dry. And sometimes you can even use sunblock foundation, the one with tint. Okay, and make sure to check the label of your sunblock because the best sunblock that's somehow effective is not less than SPF 30. 30 and above is what is recommended, especially when you are directly exposing yourself under the sun. Okay, so uh, basically that's how we have to delay. That's also one way of delaying the aging process, which I know it's a very common knowledge that you need to keep your skin well moisturized. Okay, um, this is a photo of I call healthy successful aging, and maybe to some of you she's a very familiar face, but I'm really very impressed with her because she's in her late 60s. That's why she was an endorser of a adult milk, and that has no Photoshop. She's really that one doing a headstand. I do yoga, but I can't do this. I'm a lot younger than her, but I can't do this. But look at that. It's a long work. It's an investment on yourself. And if you haven't done it and you're already like me, 50, I don't think I can catch up on this. The right time to start having a healthy, successful aging is at your 20s, 30s, and even 40s. At 40, your weight will start to increase. That's when you hit 40, all the hormonal imbalances, the delayed in the slowing down of metabolism starts at 40. So start the habit when you're younger, when you have the energy, when it's so easy for you to jump on the treadmill and run maybe for 30 minutes with a speed of 6 to 7. Well, I saw my son, his speed was, I think, 12. So I don't know how fast is that. I can only make it probably at 6, the max. For those of you who are doing treadmill, I'm sure you would understand me. But so don't miss the chance. While you are young, you have to start investing on yourself already. And again, this is your target, you know. There are a lot of home video that you can use for yoga. There's 20 minutes, there's 30 minutes, and it's just very quick. Before you go out of your room, you put your yoga mat ready and start that yoga. Especially now that it's locked down, you may not go to the gym anymore. You can just do it on your own home. And I do it. Okay? It feels good. I feel bad when I don't have a workout at first hour in the morning. Yeah, I'm guilty because sometimes I'm being called and I don't answer because it's my only time for myself. And you need that. Everybody needs time for yourself. And that's again another key to a healthy, successful aging. Okay. Now, of course, as an aesthetic and anti-aging doctor, it is our job to help you and assist. Let's say you missed those years because those years when you were in your 20s, you were too busy doing, uh, focusing on your career. On your 30s, you got promoted and you still have to do a lot. When you reach 40, that's only when you're starting to think about yourself. And that maybe now that you got promoted, then you have the resources to start focusing on yourself. it's not yet too late. And I guess that's the reason why we are here for you. No? Okay, so the anti-aging process. Let me just show you some pictures or images. That's actually very common problems now, and why there's a before and after. So you can see this one. Usually we have the double chin, and we want to have a very contoured face. Uh, okay, we have these sunspots, and we want to have a clearer face, and it can be done. We have technique using this one. Um, we call it the derma point. Now, for those lines and wrinkles on this area, okay, we have also a lot of treatment. There could be everything that we do actually is non-surgical, non-invasive. It can be both injectable and machine. I'm sure all of you know Ulthera, and it's a really very good machine. Although uh, we are allowed to open to help with the primary health care, but some patients cannot really resist after attending to their primary health care. They also would want to uh, do things for aesthetic now. Okay. Another aging problem is always the wrinkle, and definitely we can have this objective even if you have this. And I'll just be mentioning a few of those that we usually do. We would do either, again, the derma point, that's called skin needling. We can do Botox. I'm sure you're very familiar with Botox. But you see, using Botox, it requires not only science, but it requires the art. It cannot be too scientific because you're fixing on the face and it's still an art. And I would usually tell my patients, especially when I've done a lot of procedure and the patient is so happy and had, very good transformation, I would say, you're my obra maestra or a work of art because it's really more of an art. To me, it's more of an art than science. Okay. Now, another problem, you do always have fine lines and wrinkles, no? Body sculpting. When you age, you get to accumulate all the fat. And because you didn't have time to exercise when you were younger, now everything is catching up on you. This is a very common problem. It's easy, you can just wear pants all the time, but when you unclothe yourself, you say, oh, how can I remove this? And we usually do it by using, I was talking to John earlier, and she knows about mesotherapy. Okay, so we do mesotherapy. Mesotherapy is an injection technique that we would inject on those cellulites, and then we couple it with machine treatment, uh, either ultrasound cavitation or again the high intensity focal ultrasound, which is called HIFU. I'm sure you also hear about that. And all the other techniques, infrared, these are the machines we couple it usually with mesotherapy. Of course, when we do mesotherapy, which is body sculpting, we cannot not do weight management program. I would say weight management is always the foundation of body sculpting and vice versa. You cannot, let's say a patient would come to me and then would say, Dr. MJ, I am pear shaped. Okay, I will give the weight management program to lose weight. So that goes with the diet plan, workout plan. Sometimes we do IV nutrition for weight management. But then we also couple it with body sculpting. Why? If you start as a big pear, you're a pear-shaped person. So you will lose weight. If you lose weight without body sculpting, you'll just end up with a small pear, but still pear-shaped. Because when you lose, let's say, 10 pounds, the 10 pounds, once you lost it, it's equally distributed from top to toe. So it's the same, uh, it's you have the same shape when you start and after losing the 10 pounds. Now you do body sculpting in combination with weight management so that you can put more effort or more reduction on a certain area. Let's say your problem area would be the thighs, like this one. Then while we're doing the weight management, we will inject mesotherapy on this particular area, like the thigh and the buttocks, so that when you lose weight, there would be at least, let's say, 8% more on this particular area, because this is where more fat has been accumulated. Okay, so it's always a combination of weight management and body sculpting, and vice versa. You cannot keep on sculpting the body, you keep coming to the clinic doing meso every week, but you're not losing weight. So I will tell my patients, I keep removing fat, but you keep returning it back. And that's why you're telling me, how come there's no improvement? Because your weight is also not improving. So if you want to see more results, it has to be between the doctor and you. You have to do your homework. And we will teach you on a step-by-step process. And again, it's not an overnight thing. It's a lifestyle shift. It takes a while. It can even take years for you to shift to a healthy lifestyle. But it's okay, especially when you're busy. It really is very difficult. And again, it is good, you know, given this scenario that we're at home, we can really focus a lot of things on ourselves. Okay. Again, another photo of a before and after removing cellulite. I just want to tell you that yes, it is very, very possible.
Look at the Jinjin. Look.
I can hear Natalie. Anyway, there. So that's the abdomen. Mostly, the men would have this kind of belly. For you, maybe sometimes you say, "Oh, but that's not much." It is, I think our photo is reversed. I'm sorry about that. Okay, now with this kind of pandemic with coronavirus, I'm sure. Why did I include this as part of the aging process? When people age, our ability to fight the virus or any disease for that matter actually decreases. Part of the wear and tear, you know, people age. We call it age-related diseases, hypertension, diabetes, um, uh, all the other autoimmune disease. Sometimes people even get systemic lupus erythematosus, SLE. They can also get all the rhinitis, more progress, etc., etc. Okay. Now, how do you combat all these age-related diseases? Again, you have to boost your immune system. And when you boost your immune system, of course, after fixing your lifestyle, then we may already be not too afraid to to go out even during pandemic. We just have to, of course, practice the usual hygiene, be it wear mask, practice hand washing, don't always touch your eyes, nose, and mouth. Those are the things that you always have to remember. But again, sometimes unknowingly you touch your eyes, unknowingly you touch your nose, You go to the grocery, you touch the can that is being touched by a COVID person, which of course you don't know. That person who has COVID also doesn't know that he or she has COVID. Why? Because there are a lot of asymptomatic persons or patients, asymptomatic patients that confirmed with COVID. I've known quite a number. They don't have cough, they don't have fever, they don't, have difficulty of breathing, don't have muscle pain, nothing, none at all. But the only reason why they got tested was because they are healthcare workers. And once, the test turned out positive. So my colleague who was diagnosed positive after the test just had to stay, just to be quarantined, but no medications were given. And I said, congratulations, you have a very high immune system because he didn't present any signs and symptoms. Okay? So I know you have a lot of questions, but I'll just share with you one of our latest technique in boosting the immune system. I got this procedure sometime September of last year, just to couple it with our existing vitamin infusion and colonic cytotherapy, all for wellness and detoxification. I didn't even know that coronavirus is coming to Manila. So it's a good thing I was first. I was first. Nauna ako with coronavirus because when coronavirus broke out last January, I told my patient, this is the reason why, with or without virus, we really have to focus on our immune system. And it can definitely either delay or really prevent all these age-related diseases, all this viral infection, and sometimes even cancer. Okay, so may I share with you? I hope.
Mm-hmm. So first things first is we would extract the blood. Okay, once the blood is extracted, we infuse it in a saline. We call it normal saline. Then we get the same amount of ozone or O3 from that very special machine that we have. Yes. And then we infuse it in that blood that has been extracted and infused in saline. There, you'd see the blood would turn red, bright red. Yeah. And you would know that that is a process of oxygenation. Wow. That highly oxygenated blood cells is now returned back into your system.
Now you have blood with ozone. Now.
Yes.
And then what about the immune booster?
And then thereafter that is finished, then we just change the line and insert it into the concoction of vitamins, this vitamin B complex, high concentration of vitamin C. Sometimes we even put zinc, magnesium. It really depends on the needs of the person. And we insert it through intravenous therapy as well.
Oh, I'm so excited to do my ozone therapy plus immune booster vitamin infusion. I am so excited.
Okay, so yeah, that's it in a really a short discussion on from why the skin is so important. Okay, as part of the aging process. So, in a nutshell, I would ask everyone not to start working right now. Okay. So thank you. I am open to questions, consultations, whatever. John?
Thank you very much, Dr. MJ. Do we have any questions here in the chat? Anyone can everybody's unmuted. Most of us are unmuted. Anybody have a question? TikTok MJ, if ever they would have questions, they would just the ERC Gender and Development, and we'll connect them with you soon.
new normal that we have, this online consultation, consultation, whatever you have, messenger, call, I'm open. And for ERC, always an honor compliments a consultation.
Thank you, Doc MJ. I think our chair is here in the Zoom group. Yes, they're in the Zoom group. If our chairperson, Ma'am Agnes, would like to say anything.
Okay. Okay. Can you hear me now?
Yes.
Okay. Well, I came in straight from another meeting that we had with the commission. So, ano sasabihin ko? Ang sasabihin ko, palagi ako naka-online sa kanya.
Sorry, without your permission, I made you an example. I said this morning, I had messages, and it was so funny because that message even mentioned a treatment. She said, is Attorney Agnes doing treatment? She's so glowing in TV this morning. I said, paano mo nalaman? So, it sometimes really we start caring from inside. Go at there.
Experience ko naman kasi, if you look good, you feel good. If you look good, you feel good.
Yes.
But at this time, it's really more of the immune system. So immune booster is something that we can do. Yung iba na hindi kumakain ng gulay, kumain na kayo. To start with.
And yes, then, and the food, vegetables, and it's also good not just for, both immune booster and it can help you lose weight.
Pwede ba?
Yes. Substitute your vegetable with rice. I mean, instead of rice, gawin yung kanin yung vegetable.
Ang dami nun.
I haven't shared that. Remember, there's this cauliflower rice. There's also, ano ba yun? Squash rice. Diba? Meron broccoli rice. Pwede rin kangkong. You don't have to make it rice, just eat it. Nang ganon.
Mm-hmm. So, napaka-shy yata ating audience.
Ayun, we don't have much comments in the chat box. But this is a good exposure for everybody. We tend to forget that we still have to take care of our skin kahit hindi na tayo nag-aayos nagme-makeup ngayon, hindi na tayo prepare masyado or naglo-lotion, hindi tayo pumapasok in a physical office, but it's still a part of our body. And when we do self-care, it's also self-love. So, kailangan, hindi natin kakalimutan yan. Especially
I have a suggestion for ERC. Since you're having this kind of webinar, why don't you fix yourself? They're all not on video. Show yourself, fix yourself, and it's as if you're going to the office. Yeah. So that, it gives. There was a time I held a meeting with my team, and I said, you cannot show up on video during my meeting without fixing yourself, because this is work time. And do you go to work with your duster, with your with your hair just tied down? You go to work like, so why it gives a sometimes it feels good that you're fixing yourself. So open the cam, the video, and magpakitaan kayo. You have a theme. Today we wear whatever color, or have some theme of, not just the theme of the background, but even yourself. And,
Pwede naman yun. Pwede naman yan. Pwede kaming ang theme namin color of the hair. So, nagkamali ng pagkukulay kaya naging orange. Get dressed. No, really, siguro that's one of the things that we should learn, even it's really a work from home. If you don't start, diba last week, our resource person said, you have to establish a routine, even if you're working from home. So the routine starts with the usual thing, preparing yourself. But now my routine starts with an exercise, and then exercise first, and then before I take my bath or my shower, and then breakfast. So that's the routine that I've established. And at 8 o'clock, we have a mass, and Mary Jane MJ joins the mass. So by 9 o'clock, when I start my telecon and my meetings, usually I've done everything that I should be doing for myself. And now I try to really wear. Sabi ko nga, baka magsara yung earrings ko kasi yung aking, ano ba yun, yung ears ko para sa earrings. Kasi ang tagal ko hindi nag-earrings. I started using earrings only this May. When I started to think that, yun na nga, malungkot kami, namatay yung brother ko, tapos I won't even fix myself. So parang counter ko na yun for, I have to feel good. We have to feel good. So nakita ko yon na we have to fix ourselves. Kaya matapang na ako ngayon. Palagi ko nang binubuksan ang video. Hindi ko lang binubuksan. Naku, yung si Attorney Joanne MJ, naku yan. Anytime, pwedeng video.
that's why she's video ready.
Always.
So, when our situation is no longer like this, I'm very much willing to reach out to all of you and come to Zen, and give you an experience somehow. We call it the Zen experience. Don't worry. Because if you come to Zen right now, we're all in PPEs. You won't recognize us, but that's our protection. But still, we give you the experience. Sometimes, again, the feel good, look good is really what keeps us motivated all the time.
Okay, so I think people here are really having a realization on their skincare and on their daily route in their skincare. And I invite everybody to speak to the Zen Institute website, where Dr. MJ Torres will find information about their clinic and about her over there. And yes, we can all begin with what we have. So we do have our skins. We are still here and we are healthy. So that's a lot of that there's so much to be thankful. There's so much to be thankful for. So we hope to see you again on next Wednesday at 4 p.m. We have another web session prepared for ERC. And again, it will be via Zoom, and you have to check out our newest addition to our online platforms. It's the YouTube of ERC GAD, which we will also be sharing later over the Facebook page, so that you can access it, access the video, access this session with the Para MJ at your own convenience. So I'd like to thank everybody. Thank you very much, Agnes, our chairperson. And thank you very much, Dr. MJ, for creating this web event. So with this, I'd like to conclude this web session and hope you support the other GAD activities. Like the one on Friday, we'll be making ice cream to see you there. And also next Wednesday, another webinar session at 4 p.m. So with that, God bless your day or afternoon. Have your coffee break for now. And thank you. See you next time. And remember ERC cares.